This hearing of the Senate Select Committee on COVID-19. Today's public hearing will focus on the impact of COVID-19 pandemic on children and young people, but may cover other matters under the terms of reference. Information on the procedural rules governing public hearings has been provided to witnesses and is available from the Secretariat. If a witness objects to answering a question, the witness should explain the basis for the objection in sufficient detail to allow the committee to determine whether to accept the objection. The committee will then decide whether to insist on an answer. Witnesses may request that answers be given confidentially. I remind those on video conference to mute their microphones when they're not speaking, and witnesses appearing by teleconference should state their name every time they speak. Please ensure mobile phones are switched off or turned to silent. And just before I hand to our first witnesses, can I just put on the record my thanks for Senator Christina Keneally's work on this committee. She has left this committee now after the last 18 months or so, and we're joined by Senator Sheldon. So welcome, Senator Sheldon, and thank you to Senator Keneally. Can I now welcome our witnesses for the first section this morning. We have representatives from the Australian Research Alliance for Children and Youth and UNICEF Australia. Both witnesses have an opening statement to provide, so I'll go to Ms Dakin first and then to Ms Breeze. So can I hand to you, Ms Dakin?
Thank you, Chair. Thank you for this opportunity to be a part of this important inquiry into the ongoing responses to COVID-19 in Australia. I'm Penny Dakin and I'm the Chief Executive Officer at ARACI. Of particular concern to ARACI and the organisations we work with are the impacts of the pandemic and the responses and our responses on children and young people. The pandemic has both amplified the existing challenges and inequities faced by many children, but it has also seen a whole new cohort of families and children experiencing the burden of joblessness, toxic stress, and uncertainty. Australia's national focus in the COVID-19 response has largely been focused on protecting adults, and in particular, the elderly. However, the impacts on children and young people have been immense. As the pandemic lingers, we must look for these longer term effects, and we must plan for a future for all in our recovery. Now is the time for us to work with children and young people and bring our national leaders together to broker a national plan for children, a plan that reflects their unique needs and respects their ideas and the way that they can input into shaping a future that we can all be part of. To make this happen, we need to first establish a direct pathway from the voices of children and young people directly to the National Cabinet. More than half of all children and young people in Australia are at risk of adverse impacts on their education, their nutrition, physical development and movement, social and emotional well-being because of their physical disconnection from school and early learning. The research that should be jolting us into action on this is piling up. And we're just beginning to understand the specific needs of children and young people as we come out of this pandemic. Young people are telling us that they are more concerned about their future than they were before the pandemic. A recent ANU poll heard this from nearly 60% of 18 to 29-year-olds. And tellingly, only 15% said that they were feeling more positive. Economically, the pandemic has hit children and young people and families hard. The main industries in which young people work have been devastated by lockdowns, as have the livelihoods of families who are caring for children. At the beginning of this pandemic, youth unemployment was more than double the general unemployment rate. The negative impact on young people have only continued, with an unemployment participation rate of only 64% at September 2021, the lowest since the height of the lockdowns in May and June 2020. The damage so early in the careers of young people will take decades to overcome. We support the many calls from a wide range of groups to raise the rate of youth allowance and job seeker payments, and also extend existing programs that will support young people to enter the workforce and sustain their employment. Thank you again for this invitation, and we look forward to this discussion today. Thank you.
Thank you very much, Ms Dakin. Ms Breeze, would you like to give your opening statement on behalf of UNICEF Australia?
Thank you, Senator. I'm Nicole Breeze, and I'm the Director of Australian Programs for UNICEF Australia, and we're very grateful to be to the committee for the opportunity to be here today. In April 2020, the United Nations Sustainable Development Group said, "Children are not the face of this pandemic, but they risk becoming among its biggest victims." While they have thankfully been largely spared from the direct health effects of COVID-19, at least to date, the crisis is having a profound effect on their well-being. All children of all ages and in all countries are being affected, in particular by the socio-economic impacts. This is a universal crisis, and for some children, the impact will be lifelong. Around the world, unfortunately, this prediction is bearing out in full force. More than 168 million children have missed a full year of schooling, and globally, there are 7.6 million girls at risk of never returning to school. Australia's response to the pandemic has been strong, particularly when viewed in this global context. The public health, social and economic measures implemented by governments across the country have been world-leading in many respects, and they have saved lives and livelihoods. However, the evidence is clear. The pandemic has disrupted the lives of children and young Australians in profound ways. They are struggling with their mental health, and they're reporting less hope for their future. They have suffered financial hardship and job losses. They have lost learning and more from being out of school, and the pressures of the pandemic are exacerbating existing inequalities. Without concerted action, the consequences of this threaten to be long-lasting. We are concerned that children's priorities need more attention. Much of the policy response to date has been developed primarily for adults. Australia's National Children's Commissioner has been calling for a national children's COVID recovery plan for several months, and we believe that this is becoming more urgent. People's entire life trajectories are often set in place during childhood, adolescence, and young adulthood. And that is why it's essential that we act now to strengthen the protective factors around our young people. We need a nationally consistent plan which keeps schools open safely. We need to fast-track the urgent implementation of support for children's mental health. We need to protect children by boosting the vaccination of adults around them more evenly. We need to ensure families with children who have experienced extreme financial hardship are supported, and that employment pathways for young people who have lost work are stimulated. As well as addressing these acute issues, what is most needed if Australia is to chart a durable pathway out of the pandemic is to prioritise a national plan for children and young people that lays the long-term foundations for their health, development and well-being. Finally, UNICEF Australia would like to acknowledge the courage that Australian children have shown in adversity, particularly those who've been subject to extended lockdowns. We thank them for the huge part that they have played in helping to keep our community safe.
Thank you very much, Ms Breeze, for that. And can I, on behalf of the committee, thank you both for the work that you've been doing in promoting the interests of children and young people, particularly in light of the COVID-19 pandemic and some of the impacts that children and young people have been experiencing. Can I start by asking, clearly anyone who has contact with children in any way can see and understand some of this, dramatic impacts that the pandemic has had on kids and young people. What would, as we move into sort of the next phase, within the pandemic, what would be the priority that you would want to see from government? You've both mentioned a national plan, which I guess can be immediate, but also has a longer term view. But if we were looking at what were the things that needed to be done in 2022 to best support our children and young people across the country, where would you ask government to focus? Perhaps that's to both of you. Perhaps if I go to you, Ms Breeze, because you're bigger on my screen, so my eyes have gone there. And then I'll go to you, Ms Dakin.
Yeah, sure, Senator. I think some of the immediate priorities really are about children's connection to their learning and ensuring that we do have a nationally consistent plan in place that makes sure schools are able to operate safely. We need to create a situation where schools are the last to close and the first to open in any future outbreak. And we need to ensure that that this is consistent across Australia. We need to avoid a situation where schools are being closed as a first resort, and that really they are at the top of the list. The second area, Senator, that we'd highlight is fast-tracking the urgent implementation of support for children's mental health. We've seen great strides forward in this respect with the development of the National Child Mental Health Strategy, and state and territory governments also making investments in this area. But we need to ensure that implementation is working for children and young people, and we've got to ensure that this is fast-tracked so students and children can access the support that they need. And then finally, I'd say, Senator, that we have to continue to concentrate on vaccination, and we've got to ensure that the best way to protect children is to protect the adults around them, and we've got to ensure that there's good even coverage across the Australian population. And if we do reach a point where there is a safe vaccine approved for children, then it will be critical that there's appropriately targeted information for children themselves and for their parents and caregivers. And then lastly, on that note, Senator, I'd also just highlight the importance of vaccine equity globally. One of the things that most threatens to derail Australia's progress, including for our children in this pandemic, is the emergence of new strains of the virus. And we can see that whilst we're beginning to win the fight against COVID here in Australia, that's not the case everywhere. And some of our nearest neighbours have vaccination rates of only about 4%. So we really encourage the Australian government to continue to play its part through the COVAX facility to ensure that we are doing our part to help boost and protect children in that respect. Thank you, Senator.
Thank you, Ms Breeze. Ms Dakin?
Yeah, thank you, Senator. I would echo Ms Breeze's comments. We would agree with all of those points. In addition, I think one of the things that we would really like to see is a concerted effort to really listen to the voices of children and young people themselves. I think one of the things that's been revealed to us in the course of the pandemic is how insightful the thinking and the ideas of young people have been in informing strategies, the work that the Children's Commissioners around the country have been doing as a result of the pandemic to hear about the impacts of children. I think it would be a very wise move to actually do and listen to some of those voices. I would echo the comments about schools and having a viable plan to keep schools open. But I would also extend that to early childhood education and care. The youngest children in our communities have very, very much been silent throughout this process, and we would like to see a nationally consistent approach to keeping early childhood education and care centres open similarly to schools during the next phase of recovery. In addition to that, I think it's important to note that the impacts of the pandemic have not been uniform across all groups of children and young people. There are cohorts of children who have experienced the adverse impacts of the pandemic in a much more significant way. We think particularly of children with disability, children who have lived in vulnerability, and Aboriginal and Torres Strait Islander children. And I think we need to pay particular attention to those groups as well as we come out of the pandemic. And then finally, just to echo the calls I think both Ms Breeze and I made in our opening statements around financial security for families and making sure that families actually have a living income, that they can endure the ups and downs that we face as we come in and out of the pandemic.
Thank you very much, Ms Dakin. Senator Patterson, can I go to you if you have questions, or I'm happy to go around?
Yeah, thanks, Chair. Just briefly, I noted the comments you were making before about the importance of keeping both childcare centres and schools open over the next year. I guess that's because there's been a pretty significant impact on children from the closure of schools in Melbourne over the last 2 years. I think it's 220 days of schooling that have been lost. Thinking about both the next year, but also just the next pandemic, which sadly might come, should governments be, try to keep schools open more than they have over the last 2 years? Should that be a real priority?
I'll take that one. Thanks, Senator. Look, I think that governments have done quite well around the country to try and get schools open as quickly as possible. But yes, we would schools do so much more than they're more than places of learning, I think, is what's really important. Schools are where young people, children find their social connection, their identity, all the things that are really vital to them as whole little people. And everything that we can do to keep schools as Ms. Bree said, the last places to close and the first ones to open, I think, are significant steps towards making sure that the impacts of the pandemic are felt in a small way by children and young people.
And
Yes.
sorry, did you want to add to that, Ms. Bruce? Yeah.
Yes, Senator, I just echo those remarks and say that absolutely. We think it is critical that schools are prioritised to operate safely in the course of any future pandemic. And I think that, as Ms. Dakin said, we know that schools are really about learning, they're about social connection, they're about support for emotional and social wellbeing and the full spectrum of development for children, and they really have suffered through this disconnection. So we would see it as a key priority in preparedness for any future event.
Now that we have such high rates of vaccination, particularly in places like Victoria, New South Wales and the ACT and other states catching up, should schools be closed every time there is a positive case or can that be safely managed? It appears, even with children being unvaccinated, that the severity of disease for young people is much more modest than it is for older people.
Senator, we'd say that the health advice is critical here in relation to directing those decisions. But what we would also say is that we've seen it possible in the UK through the use of rapid antigen testing, and we've seen recently new research by the Doherty Institute here about the test to stay regimes. We have seen evidence in the UK over the recent summer that it has been possible to minimise disruptions. So that's what we're looking for, really the adoption of these test to stay type of approaches and really minimising the impact and disruption for children. Of course, there will be situations where schools need to pause briefly, but we're really looking for the minimum disruption to children because of these adverse impacts and these impacts that may be long lasting.
Yeah.
Can I just add, Senator, I think we were pleased to see announcements by both the Victorian and New South Wales government to explore rapid antigen testing in early childhood education and care settings. I think it'll be interesting to see how that pans out. Obviously, these are the very smallest children, and getting them to do a test frequently may be a challenge, but it's great to see that the governments are taking steps forward to exploring those options for ECEC as well.
Okay, just a final question from me then. When will we see this showing up in the data, and which data do you expect it to show up in? The impact of school closures and disruption. What should be the signs that we're looking out for? What will the evidence base be?
Yeah, great. Thank you, Senator. Fabulous question. Look, we haven't seen the 2021 early development census data yet. That should be available early next year, and I imagine that there will be impacts in that data, and also the 2021 NAPLAN results will also be a place that we'll need to keep a close eye at. From an Eracy point of view, we're interested to see what happens, particularly around widening inequities. We would anticipate that we'll probably see in both sets of data kids who are doing okay will probably continue to do okay. Kids who were struggling prior to the pandemic will probably be struggling more. The data, we haven't seen the data yet, but we'll be very interested to see both of those data sets when they are available.
Just on the data, Senator, the Australian Institute of Health and Welfare in June, just recently in June, published an extensive piece on COVID-19 and the impact on young people. What the Australian Institute of Health and Welfare is saying is that the situation is complex and dynamic. However, it's really indicating that the consequences of this disconnection to school is likely to be long-lasting, and is strongly recommending careful monitoring of these outcomes and a tailored and targeted plan to ensure that students remain on track.
Okay, great. Thank you. Thanks, Chair.
Thanks, Senator Patterson. Senator Cox.
Yes, good morning.
Good morning. Early morning to you over there. My apologies.
It's only 6:30 for me, so very early. I'm interested to, and thank you both for your evidence this morning and appearing. I'm interested if there is any data in relation to the adverse impact of the pandemic on First Nations children and young people.
I'm happy to kick that off. Look, there are a number of studies that are in the field at the moment, I would say that generally speaking, we don't have as much data on Aboriginal and Torres Strait Islander young people as we would like. We have seen that First Nations students in public schools were 4 times less likely to have the internet in their home in the course of the pandemic. One of the key pieces of data that does exist for First Nations children and young people, 4 times less likely to have internet in your home means that you're 4 times less likely to be able to do online school and 4 times less likely to be able to keep up with your peers. I think that's a challenging statistic.
I think also, Senator, the Australian Government commissioned 6 pieces of research, and the Australian Institute of Health and Welfare refer to these pieces, and it indicates that First Nation students are also particularly vulnerable in the context of remote learning because they're not able to access Indigenous learning support, and some of the methodologies that work for First Nation students are more complicated to adapt into these remote technologies. So there's some evidence around that. And finally, what we know is just because of the relative youth of our First Nations communities, we need to achieve, the equivalent of 90% vaccination coverage in those communities to afford the same degree of protection in non-Indigenous communities.
Yeah, great, thank you. Which is quite difficult in a state like mine, who only have 22% of overall vaccinations in their adult population. So quite the challenge. Are you able to speak to, I know one of, I think it may have been you, Ms. Dakin, talked about the decades of, to overcome this. Are you able to talk a little bit about the intergenerational impacts or long-term impacts of this pandemic on children and young people?
Yeah, certainly. My comments were originally made in relation to the loss of early experiences of employment and early income. I think one of the things that we know from previous incursions into youth employment like this is that early career formation happens at that early, when you're young. You have a job, often a part-time job during high school, which sort of sets you up and equips you and helps you to understand how work works. And then you transition and you move through your career in a trajectory. What we are likely to see, and there's a lot of work that's come out of Melbourne University, and Professor Jeff Borland particularly has written some really great pieces about this, is that these young people who are losing those opportunities right at the moment, so not only losing income, which will obviously have a flow-on effect. Obviously, you have less income when you're young, you're going to have less income as you get older, and that's going to be harder to overcome. But it's those life experiences of having your first job and learning how to get up or be on time, or the key skills that we learn through early employment are going to be later to come for this generation of young people who are experiencing the pandemic. That's going to have consequences. Some of those are going to be things that some young people are going to be easily able to work through. They're going to have plenty of opportunities and they're going to be, taken in their stride and go forward. But young people in vulnerable populations are where employment may not rebound as quickly, where the jobs that they might have traditionally moved into as their sort of first job don't reappear, are going to obviously struggle for longer. This can have significant consequences. So if you're later to get to an income point where you feel confident to settle down and have a family, it might mean that you're later to do that. It might be later to have your own children. You might have to do, you might not choose to go on to university study. Those impacts are things that we're only going to see over the next 10 to 15, 20 years as well.
Great, thank you. Ms. Breeze, did you want to add anything to that?
Yes, what I'd say there, Senator, is, and that underscores the reason as to why we're recommending it's so important that Australia focuses on a national plan for children and young people. We really need a belts and braces approach here. We can't leave some of these things to chance. As Ms. Dakin has indicated, the consequences threaten to be long-lasting, and it's really critical. We're not suggesting that anybody has intentionally forgotten to think about children and young people, but what we're saying is we really need to elevate recognise them as a distinct stakeholder group in our population and elevate planning for their development, safety and wellbeing as a priority. There is some risk in just leaving this to chance and assuming that policy settings, which are developed primarily for adults, will do the job for children and young people. As I said in my opening statement, the National Children's Commissioner has been highlighting the importance of this, and we really support her calls for the elevation of a national plan for children and young people.
Great. Just on that, on the national plan, have there been any discussion directly with government from either of your agencies?
I think on our side, UNICEF Australia, we have had a range of positive interactions across the Parliament, in fact, just before the lockdown, and we often provide opportunities for young people themselves to interact with decision makers across the federal Parliament. We believe it's important that young people have a voice and are able to have a say in decisions that influence their lives. We have consulted with 3,500 young people across the course of the pandemic, and the young people had the opportunity to reflect their key concerns to government and right across the Parliament. And this recommendation around a national plan was front and centre in our previous exchanges. So certainly, Senator, it is an issue that has been raised. We are aware the National Children's Commissioner has raised that also with government, and we just like to get on the record our strong support for this as a critical action.
Our interactions have been very, very similar. We, in partnership with UNICEF, released a report earlier this year called Kids at the Crossroads. Even before the 2020 wave of these lockdowns, that report similarly calls for a focus on a joined-up national plan, and we have briefed a number of senators and members across Parliament from both sides of the chamber.
Right. Can I just ask what the demographics were of the 3,500 children or young people?
Yes, Senator. They were aged between 15 and 24 years old, and they were drawn from every state and territory across Australia, including regional, remote and urban settings. So that's a general description of the demographic.
Great. Thank you. No more questions from me.
Thank you, Senator Cox. Go to Senator Sheldon. Do you have some questions?
Thanks.
Thank you.
And good morning, Ms. Bruce and Ms. Dakin. Good to see you both. Thanks for your time this morning. I just want to go back to a point you were making for Ms. Bruce about pathway to employment for young adults, and what are some of the things that we need to be thinking about or need to be putting in place so that we can give our kids an opportunity for the future to get jobs and skills and that kickstart in their early years. If you could expand on that, that'd be great.
Yes, Senator, thank you for the question. I think the first point we're making, of course, is that the industries that employ young people have been amongst the hardest hit in this pandemic. So they really have experienced the brunt of some of the disruptions to the economy and to employment. So we think it's critical that there is targeted support provided to some of these industries to help to assist them in their capacity to predominantly hire young people and to incentivise some of those practices. And we think that to call out some of the work that the Brotherhood of St Lawrence have done in this space, and I think there's some good models in the community which look at how you can boost youth employment rates when you bring together business, education and training providers, government and community, and of course young people themselves, as demonstrated through some of these initiatives that the Brotherhood of St Lawrence are leading. So we do believe, Senator, that there's some good models in the community. We'd suggest that these require further examination, and that we really just think from incentivising these industries to proactively hire, engage and support young people through to some innovation in models would be some of the things that we would recommend are given further consideration.
Just before, I'm just going to ask Ms. Dakin in a moment, but just on could you just expand on the Brotherhood of St Lawrence? You mentioned that a few times in your answer about the specific, how that program you think particularly highlights the sort of advancement in trying to make sure that we get youth and young adults into a career path.
Yep. I think what that program does that is valuable, it is helping to promote the referral of young people who are unemployed to sort of transition to work support initiatives. It's also an investment in local community-led solutions, which help to address local employment, and we think that's really important. And it also seeks to provide additional funding to support business-led community investment committees that help to marshal government and community resources, which help to directly link supply and demand. So what we think is promising about that initiative, as I said, it's genuinely a multi-stakeholder initiative engaging local enterprise, young people themselves, and with the support of government investment. It provides a model which I think is important to learn from and attempt to scale.
Thank you, Ms. Bruce. Ms. Dakin, would you like to add anything to that?
Yeah, only to sort of, I guess, emphasise that programs, employment programs are primarily about finding a young person a job. I think it's important to remember, particularly for vulnerable young people, people who've been really adversely impacted by the pandemic, that there is more to them than just they're a human who needs a job. And we would strongly recommend that programs that are targeting young people to get them into employment take a very holistic approach to understanding that young person. So to understand all of the other elements of their well-being in helping them find a job. A young person is much better able to find a job, take up the opportunity and see it to its full potential if all of the other aspects of their well-being are being served. So we would just recommend thinking about those programs as responses to holistic people, not just people who are employed.
Look, thanks very much for that. I just Ms. Bruce, I just go back to you as well. There's obviously a great deal of concern about the inequality across both the responses, but also what we need to be doing coming out of through this COVID period. One of the things that was raised, and I'm interested in what your thoughts are on what the impact may have been regarding could JobKeeper have been better designed so that more adequately captured young people, particularly as we were mindful that people working less than casuals working less than 12 months in particular, so the irregular casual work arrangements. So is there a thought about what we should be giving a better ability to exist through the potential lockdown phases of the pandemic? Is from our past experience what ideally could have been done, and I'm mindful that there is some lockdowns occurring in countries that are in a very similar position to us. What are some of the things we should be forward thinking, particularly for our youth and young adults?
Yes, Senator, thank you. What I would say is, again, just to reiterate the point that we did see young people highly represented in the industries that were affected negatively through the pandemic. And we also saw families be placed under stress through loss of household income. So there were reports at the point at which the social protection mechanisms were boosted to help provide support for those young people and those families of very positive benefits through that. So families reporting that it was possible to buy fresh fruit and vegetables from the supermarket and to supplement a nutritional diet for their family. So I guess the point I'm making is we did see the positive impact in strengthening the social protection framework around those families who are vulnerable and who have been hit the hardest through these economic shocks. So without being very specific about what the nature of these schemes need to look like in the future, Senator, we would just make the point about the importance of permanent and adequate social protection for families.
Ms. Dakin, you've made some comments before about this. Would you like to add anything to Ms. Bruce's comments?
I would. One of the things that Eraser did during the pandemic, the first 12 months of the pandemic, we collected wellbeing data from around 28,000 kids across the country. And one of the things that we saw in that wellbeing data was students consistently reporting that their material well-being wasn't causing them problems. The only explanation for that, given all of the challenging circumstances of last year's lockdown, could be that the income support payments that families were experiencing were actually helping to offset any concerns that they might be experiencing in that material well-being. It suggests that those payments where, as Ms. Breeze points out, that families could buy food, they could pay rent, the material burden wasn't being experienced by children. On the opposite side, that data also showed during the pandemic that young people were experiencing quite high levels of anxiety. They were concerned about other things. So I think it speaks to the success of those income support enhancements during the pandemic.
Good, thanks for that. Both of your evidence is very helpful. Just with the question about the income support, which is really quite critical, you both outlined in answering a number of questions, including mine. I just want to go to that sort of the question of the cohort that was affected by not receiving JobKeeper. So those that have fallen into that category. What were some of the impacts that you saw and you researched highlighted some aspects of that? Maybe to you, Ms. Dakin, first.
Thank you, Senator. I'm just looking for a statistic. I can't find it right off the top of my head. We do know that for that cohort of young people who didn't qualify because they were casual and hadn't been working long enough, that a significantly high proportion weren't able to pay rent and weren't able to purchase basic necessities. I guess what that would suggest is that, at my previous testimony, obviously where families were able to access that payment, it worked, it was effective, but where young people themselves weren't able to be able to do that, then they certainly experienced difficulties like not being able to pay rent. Anecdotally, we are aware that a number of young people were forced to move home and back in with their parents, which it upsets even the rites of passage of growing up in this country. So, the impacts were significant.
Thank you. Ms. Breeze, do you want to add anything into that?
Senator, I don't have any disaggregated data on hand around the variance between these cohorts, but I would reiterate what Ms. Dakin has said. The ANU poll of 2020, one of the key statistics there is that nearly half of the 18 to 24-year-olds who were surveyed did report being unable to pay their rent or mortgage on time. So there certainly is sufficient evidence of the duress that young people and families have been under.
And Ms. Dakin, if you can find that figure for us, then please grab it for us.
It was the figure that Ms. Breeze just gave you.
Thank you. Just want to get this question of, in light of the fact the impact of some of those that, and particularly youth that had less than 12 months or irregular casual work, do you think that the program on that aspect could have been better designed, that would have helped those members in our community, those young and youth? So if JobKeeper had been better designed, and particularly looking at that cohort of people that missed out on JobKeeper, do you think that there's a policy need for us to address that along with the many issues that you've rightly raised?
I think, Senator, taking a forward-looking approach to the question you're asking, what we're saying again, and I come back to this point about how important it is that we do develop a national plan for Australia's children and young people. That plan needs to be comprehensive and it needs to integrate the dimensions of well-being. It needs to, as part of that, consider what is adequate in terms of social protection, alongside the work it needs to do to help to continue to stimulate opportunities for young people to participate in the workforce. So my response to that would be more about how important it is to pay attention to this data and some of these difficulties that our families and children and young people have been subjected to through the pressures of the pandemic, and to ensure that the forward design of policy is giving due consideration. We
would just echo Ms. Breeze's comments and I think indicate that, whenever policy like we were sort of forced to create at the start of the pandemic is done, there are always things we can learn and we can always do it better next time. And one of the things that will be interesting to see is, as we look back and review the effectiveness of those policies, what we can learn and what we need to take forward. So we look forward to seeing those learnings shared so that we can design better policies in the future.
Thank you. I just want to go sort of probably the final question. That just want to road test some evidence that we received during a recent Senate job security inquiry, and we heard from a particular young worker, Sabrina Clark from the ACT, who spoke of a horrifying existence in casual, insecure work for the past 10 years, which only got worse during the pandemic. She said, at my breaking point, I got a credit card so that I could quit my second job. Since then, they have been accruing debt. During the pandemic, I was fired with only 4 hours of notice. I had to use my credit card to pay for daily expenses and amassed a $5,000 in debt, which on my casual pay rate will take several years to pay off. Most of my workmates have similar experiences, many of them worse. None of them felt safe enough to share their stories with you today. So that question about, is it common for young workers and that are facing any prospect of things improving as we come out of the pandemic? And is there particular policy settings again that, in addition to anything you've mentioned already?
I would say certainly, Senator, that we have seen evidence of young people under similar stress as the example that you have given. We have seen young people across the country really at the front line of efforts against this pandemic. It's young people who are employed in our supermarkets, stocking shelves and bearing the brunt of anger and hostility during the toilet paper wars. Young people have been on our front lines, and as adults in the household have lost their incomes, we have seen young people increasingly needing to increase the hours of work that they're doing alongside their studies, just to keep families afloat. Certainly we have seen our young Australians under stress, and the financial pressures of job losses and disruptions to the economy are being sharply felt. And again, Senator, I just come back to that point about how important it is that we have a comprehensive plan in place which does support and prioritises our young Australians to thrive across all aspects of their wellbeing, including participation in the workforce and the economy.
Ms. Dakin, before I hand back to the Chair, have you got some additional comments?
Only to emphasise the points that I made in my opening remarks around the very low rate of employment participation by young people at the moment. I think 64% I said in September 2021. I think that's a concerning piece of data, and I think whatever strategy we take forward, we need to be very mindful about lifting that participation rate. I think, again, anecdotally, we have heard stories from young people who've talked about, particularly young people in that 15 to 18 bracket who are probably living at home, who have, even though they might have kept their job during the pandemic, lost shifts because good employers were looking to make sure that they gave those shifts to slightly older people who weren't dependents and who were therefore weren't supported by their parents. I think we need to be mindful of all of those cohorts. As Ms. Breeze said, a national plan that actually looks at all of the aspects of a young person, their ability to participate in employment in their community is a vital aspect of that. And each cohort of young people has a very different experience. So we can't just assume that by doing it for one group, we're going to capture the things that matter for all of those cohorts. So a very comprehensive and targeted a plan that focuses on the different age cohorts is going to be necessary if we actually want to overcome all of these challenges and in their different nuance across the different age ranges we've spoken about.
Just on that evidence, Ms. Dakin, just a follow-up question. In light of the fact that there was such an impact on casuals that were working irregular hours, which was, as I understand, commonly young adults, our youth, do you think there was a degree of, in light of that, a disproportionate impact during the pandemic on young working adults?
Definitely. It's fair to say that cohort of people have borne an incredible burden on a number of fronts, employment just being one of them. And we need to really think about how we support them now to overcome those challenges and the dints that, they've experienced in their mental health as a result of this. A lot of identity is created by employment and who you are and how you perform. These young people are going to be challenged on that front as well. So yet again, just speaks to that need for a really comprehensive look at what we can do to support these young people.
Thank you. Chair.
Thank you, Senator Sheldon. I've just got a couple more questions. Senator Davey, I'll just check in with you to see, or can you send me a message if you'd like the call? Thanks. Mental health. So this is going to be a really big area of need, and it has been. I mean, it was already a big area of need for children and young people prior to COVID, but anecdotally I'm hearing, certainly in the ACT where we have had an outbreak, that children presenting with significant mental health concerns are getting younger, and the first point of contact they're having is at the hospital emergency department, which is deeply troubling and is a change, I think, to what we were seeing before COVID. So, what is the priority for mental health? I mean, I know we always say put extra money into mental health support, but again, acknowledging that we're not going to be able to do everything at once, what is it and where should it be provided? I mean, we have Headspace, we've got primary care doing a lot of the heavy lifting, GPs are overwhelmed. Again, in the feedback I'm getting from presentations of younger people with significant mental health concerns. So what is the immediate response to that pressure? Where should we be looking? Because again, you can't just dream mental health workforce out of the air. What would be the best thing we could be doing to try and reach children and young people as soon as we can?
Thank you, Senator. I think, unfortunately, you're right in terms of these trends, and the data does indicate a worsening trajectory of mental health outcomes for our young people. I think, as you say, there and as I mentioned in my opening statement, there has been strong focus on this problem by governments here in the Commonwealth and also at state and territory level, and that's a focus which we welcome. I think the new child mental health strategy, the national strategy, is a really important strategy for the country. What is good about that is it's focused on a child-centred approach. It emphasises the importance of reducing stigma because unfortunately stigma remains a key barrier to access for young people. In the young people we've spoken with, they'll often give examples of, well, I know where the services are, but there's no way I'm working past my mates to walk into the room and access the support that I think I need. So a big emphasis around the reduction of stigma is really important. I think what the new strategy does, which is also very helpful, is it presents a continuum framework for how we think about mental health. It recognises that all of us, including children, move in our lives across a continuum, of being healthy, coping, struggling and unwell. And what young people have said to us, Senator, and we've worked a lot with young people in drought-affected communities in New South Wales and also with children affected by the bushfires over the 2019-2020 summer. And what the young people say to us is, in some cases, what we're experiencing is just the impact of stress and duress. So what we need is this preventative support, peer-based models and opportunities through our schools to engage in evidence-based programs around wellbeing. So, and what young people are saying is that too often we take a very clinical approach to mental illness, and we're dealing with mental illness at that sharp end of the spectrum. And of course, we do need to deal with mental illness at that sharp end of the spectrum. And as you say, there are challenges particularly associated around the workforce that also the strategy highlights, and we would really strongly prioritise the improvement of the flow of workforce resources in this space. But I guess my if I come back to a simple answer to your complex question, it is really starting with this work to address stigma and support young people and their parents and caregivers to be able to access help and support. It's investments across all dimensions of that continuum, and also recognising the roles and the connectivity that's required between places young people are in their daily lives, so schools primarily, and an approach to building and boosting resilience and wellbeing.
Ms Dakin, did you want to add to that, or has Ms Breeze covered it?
I'll add a couple of things. I would certainly echo Ms Breeze's comments. Certainly the focus on prevention and early intervention is vital. And again, to echo the importance of full implementation of the National Child and Youth Mental Health Strategy. The work's been done. The people at the Mental Health Commission who did that work put together an amazing document, and we fully support its implementation. One of the things that we consistently hear ourselves is that mental health and wellbeing are two very, very different things. And I think when we take a step back approach and we look at the wellbeing of young people as a whole, and we look at all of the domains of wellbeing, and Erase's NEST framework will tell us that, you know, to have full wellbeing, to thrive in Australia, a child needs to have each of those domains fully met, and they are that they need to be valued, loved and safe. They need to have their material basic needs met. They need to be healthy in every aspect. They need to be learning. They need to be participating. And by that, we mean participating in school, in family, in community life, participating in decision making that impact them, and participating by having a voice, where on issues that impact them, young people's mental health is improved when they are able to participate and have a voice. And then finally, they have to have a positive sense of their own identity and culture. And when those things are all in place and fully supported, then a child is really thriving. We would, I guess, suggest an emphasis on a much more holistic approach to young people, particularly in that prevention and early intervention area, that allows all of those aspects of wellbeing to be thought about and to be discussed in safe and supported settings, and where, you know, it may not be a clinical mental illness issue that's impacting young versus poor mental health outcome, that we're able to respond to all of those needs in evidence-based ways by people who genuinely care about these young people. When we can have those settings in place, then I think we'll really see a turnaround in the mental health stats.
Thank you very much, Ms Dakin. And you've both called for a national plan for children, I think. Is it children and young people, or do you want like a national plan for children and a national plan for young people? That just a genuine question there. And also, like, why isn't there a national plan? I know state and territories have plans for children and young people normally, certainly did in my time. You guys are putting out a fair bit of research. You measure and report. You know, I think UNICEF's, you know, do that annual report, I think, don't you, on the kind of the children wellbeing analysis. Like, why isn't there a national plan for children? Has it just been something that's been devolved back to the states?
I think, Senator, one of the issues with children is that it's, first of all, children that don't hold a cabinet level position in government. The Minister for Children is Assistant Minister. So it sort of has become one of those things that is everybody's job, therefore it's nobody's job. And we know that all of the issues that impact children sit in multiple portfolios across the Commonwealth, from education to social services, so many different portfolios of responsibility, that there's no amplification up to that significant cabinet level position. There's nobody in cabinet whose responsibility it is to argue and advocate for the interests of children. And I think, you know, that's probably one of the reasons we don't have a national plan.
Yeah, I would say, Senator, it's probably there's been a mainstreaming approach to thinking about children and children integrated across mainstream planning and the development of policies. But the lens on that policy development is often adults. And what we're seeing, I think, are weaker outcomes because of that. And it's really our key ask. We need to recognise how important it is, and exacerbated by the pressures of this pandemic, that we elevate our national focus on our children and our young people. We recognise that all policy is children's policy, but we've got to invert the way we're thinking about developing responses for them. We've got to put a child in the centre and build out around them. And it really is something that we see as essential and something so important for our next decade.
Yeah. I mean, I was shocked when I read the World of Influence report that you guys released, I think, late last year, to have Australia ranked 32 out of 40. I think that might shock most Australians if they actually understood that. I think there's a general acceptance that we understand there's some children that don't do particularly well and suffer disadvantage, but I think if you said to people we are 32nd out of 40 when ranked against other wealthy countries in terms of children well-being, I don't think that would be well understood at all.
No.
Yeah. Okay. Senator, we've just got Senator Lambie had a couple of questions. She's come in. Sorry, Senator Lambie, I'll hand the call to you briefly because we have got about 4 minutes.
I just wanted to ask you both because I think we've already known about what's been going on with the kids here for the last 20 years, right? So like a resilience. Let's be honest, this has been the tipping point. This has opened everybody's eyes. This starts from a very early age of teaching them resilience. Do you have any plan of attack to do that? Do you have any plan to call for cadets back in school in grade 7, anything like that? Because sitting here texting each other and not learning how to communicate, not climbing trees, not getting out there amongst nature is not assisting. This is where we're at. So it hasn't just been the pandemic, this has just been brought to the surface. This has been going on for a long time. So do you have any action to hit? If you want to change something, then unfortunately you have to change with that next generation. I think we've all learnt that, okay? There's no doubting that. So do you have a plan of attack for those kids that are 4 or 5 when they're first entering school to try and build their resilience then, so we actually don't get to the point of mental health issues in the first place?
I'll go first if that's all right, Senator. Look, I would actually say that, in fact, I think the current cohort of young people have been remarkably resilient. I think we could always improve resilience, don't argue with you there. But I think actually considering the things that, many of them, as Ms. Breeze was talking about earlier, who have lived through bushfire, drought, floods, pandemic, they've actually been, many of them have been fairly resilient. To your point about what we can do early, I completely agree. I think those first years of a child's life even before they hit main sort of primary school, there is a lot that we can be doing. We would strongly support steps towards 2 years of early childhood education preschool as a really powerful way of teaching kids those skills that you're talking about, Senator, highlighting and supporting their development of executive functioning, of negotiation skills, of intense play-based learning where they can actually exercise all of those things all those skills that are vital to actually build that resilience for a very early age. That is one of the, I guess, underexplored benefits of preschool and early education and care. So our plan would be to support those other organisations who are calling for a national approach to early education and care.
And very briefly, Senator, because I think we're running out of time, I think you make an important point here. And I do come back to this continuum and how we need to think about health, development and wellbeing. Headspace, when it did its extensive study last year with young people, talks about the importance of reinforcing and enhancing resilience in young people as a critical strategy. And what that means is we've got to help to promote activities, hobbies and self-care for our young people. And we've also got to look at positive health promotion, which does intentionally engage young people in these type of activities, which are boosting and building and enhancing their resilience. But I think we also can't forget the situation for young people who do find themselves in duress and stress and the need for additional support. But it's got to be interventions across that whole gamut, Senator. I would agree with you.
Right. So can I just have one more question, please, Chair? Just a quick one. I have been writing to Mr. Hunt, and people know I've been calling for this. It's for the counsellors. I've got qualified counsellors out there that he won't put on the Medicare rebate. Now, I don't know whether he's ever been to a rural and regional area that's run down, the mine's closed, but he may want to get out there, but you do not have them. So I've got counsellors out there putting their butts on the line, helping their own local community basically haven't got coverage because they can't charge them. Their heart will not let them charge them if they need some psychology or some counselling. Are you guys pushing for that? Because I know a lot of counsellors are out there that are saying, yeah, just do something. But I can't do this for 8 hours free every day. This is where we're at. I've got school kids out there, school kids that are waiting 3 months to see somebody. Yet once again, I've got spare counsellors on the ground. Are you guys pushing behind any of that sort of stuff?
Yes, Senator. We believe that young people need greater access in terms of the support for their mental health and wellbeing, and we've got challenges to the workforce. So we do believe it is important to boost access and opportunity for young people to a range of mental health practitioners, including counsellors. So yes, we've been engaged in that conversation as well.
Yeah, likewise, Senator. We're also, keen to see adequate resourcing for all people who work with children and young people, so that they are actually equipped to have those really difficult conversations with young people who are struggling, not 3 months down the track, but there and then when they actually are struggling in the first place.
Okay, we will have to leave it there. We've run out of time. Thank you so much. Can I thank Ms Dakin from ARACI and Ms Breeze from UNICEF for appearing today. We really appreciate the time and effort you put in to your evidence this morning and the important and continued role you play in the lives of our children and young people. And, it's an important part of the work the committee's been looking at in this year and will continue into next year. So thank you very much again for your time this morning.
Thank you.
I'll just check and see if we have our next witnesses. I can see their tiles. So we've got, I'm just checking. Yes, Dr. Steer. We've got, okay, thank you so much again. We've got Professor Sharon Goldfeld and Professor Andrew Steer. Thank you very much for appearing again for another appearance before our COVID committee. We really do appreciate it, and we thought you were important witnesses to get as we continue following the impact of COVID-19 on the lives of children and young people in Australia. We have a copy of your opening statement. Who will provide that? Shall I hand to you, Professor Goldfeld?
That's right. Yes, I'll start, Senator. Thank you so much.
Thank you.
Good afternoon, Senators, and thank you for the invitation to speak to the committee today on this important subject. I'd like to begin by acknowledging the traditional owners of the land upon which we meet today. I'm standing on the land of the Bunurong people of the Kulin Nation, and to pay my respects to elders past, present and emerging and any Aboriginal Torres Strait Islander people here with us today. My name is Sharon Goldfeld. I lead the population health theme at the Murdoch Children's Research Institute. I'm the director of the Centre for Community Child Health, and I'm also a paediatrician, a developmental paediatrician at the Royal Children's Hospital and a professor at the University of Melbourne. I'll let my colleague, Professor Andrew Steer, introduce himself.
Thank you, Sharon, and good afternoon, Senators. My name is Andrew Steer. I lead the Infection and Immunity Research theme at the Murdoch Children's Research Institute here in Melbourne. And I'm also a paediatric infectious disease physician at the Royal Children's Hospital in Melbourne and a professor in the Department of Paediatrics at the University of Melbourne.
The Murdoch Children's Research Institute, or as we call it, MCRI, is Australia's largest child health research organisation. We're an independent medical research institute and a registered not-for-profit organisation. The MCRI is the research custodian of the Melbourne Children's Campus, which is a long-standing partnership between the MCRI, the University of Melbourne's Department of Paediatrics, the Royal Children's Hospital and the Royal Children's Hospital Foundation. Collectively, we're a multidisciplinary team of more than 1,300 scientists and clinicians who lead local, national and international research programs in infant, child and adolescent health. We established a COVID-19 research consortium in March 2020, and throughout 2020 and 2021, we and our partners have conducted research to understand how COVID affects children and adolescents. We also produced and contributed to research summaries and hosted or participated in online webinars, podcasts and media interviews to keep the public informed. We've previously presented, as you noted, to this committee on the direct effects of COVID-19 on children, which I'll refer to again. In regard to today's hearing, we'd like to highlight that our researchers have also investigated and reported on the indirect effects of the pandemic on children and adolescents and their families. These are the effects not related to the direct impact of COVID, but are emerging around the world as the most substantial impacts on children. Our population health and clinical science teams in particular have been working with some of the most vulnerable families during the pandemic. This includes following up around 8,000 children in our existing cohorts to understand the mental health impacts of COVID, including families already experiencing adversity. We've also followed up children with chronic disease and noted their experiences of the pandemic. And finally, understanding the mental health impacts for children who actually experience COVID directly. Our infectious disease clinician researchers and immunologists have also continued working closely with the Royal Children's Hospital to study the direct effects of COVID on children and adolescents. These teams have found differences in children's immune system responses that help explain their resilience compared to adults. The researchers also collated data from Victoria and Australia on child and adolescent hospital admissions during 20 and 2021, and recently compiled international data from comparable settings during the Delta wave, and have shown that even with Delta, although children can and do get sick, children overwhelmingly experience mild or no symptoms, and around 1% of those with symptoms will be admitted to hospital, and that death is rare. Again, we would like to thank the senators for their invitation to attend today's session, and we look forward to answering your questions.
Thank you so much. And again, I really appreciate it in your busy schedules that you found time to appear before us today for this hearing on children and young people. Can I start with a question around your views on vaccinating the 5 to 11 age group, or the under 12s essentially? The question is, I think I saw an article from the Murdoch Institute that did kind of essentially say that we needed to take a cautious approach to vaccinating the under 12s. Could you just expand on that for the committee?
Thank you, Senator. I think that you're referring to the article that was in the Sydney Morning Herald and The Age yesterday, written by myself and Maggie Baker.
Yeah, I think it was a
and
bit.
Brendan Craig.
Yep.
I guess a couple of initial key points. The first is that it's pleasing to see the results of the trial of the Pfizer vaccine published in 5 to 11-year-olds. And that trial was a well-conducted randomised trial that included around about 1,500 children aged 5 to 11 who received the Pfizer vaccine. And an important note there is that the Pfizer vaccine for children aged 5 to 11 is different to the Pfizer vaccine for older children and adults. That's 1/3 of the dose. So it's a sort of first important point to make. And in that trial, around about 1,500 children who received the vaccine, it was safe and it appeared to be effective. So now we're in a situation where we've got this initial trial that tells us that we've got a vaccine that looks like it will be effective. And the question is, so when is the right time to start delivering that vaccine in Australia? And that's obviously a decision for the TGA and for ATAGI to advise on. I guess some of the important considerations and the caution that we discussed in our article and that we are thinking about is balancing the risks and benefits of the vaccine. And I think in 1,500 children, that doesn't quite give us enough information about the risks. In the normal due process of a vaccine study, there would then be further studies where we look to look for more safety information in a larger cohort of children who are vaccinated, so that we know that the vaccine is safe. And I think with the mRNA or Pfizer vaccines, the probably biggest concern we have is around the myocarditis or pericarditis, which has been described in young adults in particular. In after the second dose in young males is around 7 per 100,000. And I think it's really important to say that the majority of the people that have experienced that side effect have recovered, but it is important in our risk-benefit analysis. And so we have an opportunity now as the vaccine is being rolled out in the United States and Canada. And my understanding is that around 400,000 children have already received the vaccine in the first dose, that we have an opportunity to make sure that the vaccine is safe. I think there's every reason to think that it will be safe, but without the data, we can't be completely sure. And so that's the reason for that, our thinking and the discussions around some caution.
Sure. Okay. Thank you for that. Can I ask also the work you're doing, the indirect effects of COVID? Professor Goldfeld, did you want to go through that a bit more? You've got 3 dot points listed there. Particularly interested in how you're following up those 8,000 children and what you're seeing from that work. Actually, I'm interested in all 3. I don't know how much time we have, but just what you're seeing from that, the evidence you're collecting from those different areas. If you could just touch on that, that would be very handy.
Thank you, Senator. I'd be delighted to. And can I say that it's fabulous that we have some of these data that I'm going to share with you, but also just note that I think there's probably a dearth of good population level data, particularly on following up children's mental health, and perhaps that's something we might think about into the future about how we might do that as we emerge from the pandemic. But let me share with you some of the things that we've been finding from a number of studies, some of which have been published and which we can share with you. The first is in one of the studies, we found that about 1 in 5 adolescents have reported, and this is right sort of in the 2020 sort of phase of the pandemic, reported frequent suicidal or self-harm ideation. And we're seeing this in other studies from other people. The Commission for Children and Young People in some qualitative data showed exactly the same thing, that there was definitely this increased self-harm ideation, and we saw more self-harm presentations to the emergency department, certainly through the tail end of 2020 and the beginning of 2021. And you'll realise that this is times when, in Victoria at least, we were in and out of lockdown. The second is we've got a study that we've been looking at women already living in adversity, so women who are already mainly unemployed and high levels of poor mental health. So 1 in 4 of those mothers who already had a history of social adversity reported job or income loss, and nearly 1 in 2 reported significant family stress. Now, I don't think that will be a surprise to anyone, but when you actually see the data in front of you, it is kind of pretty confronting. In the same sort of study, we also looked at these women with in adversity and their young children, and they reported 1 in 3 of those parents with young children reported experiencing some form of financial difficulty. And I'll come back to this financial difficulty issue again, because I do think it's something that we need to think about going forward. Similarly, in another study, we've looked at those particularly who were hit hardest. And we note that those who are already living in adversity, and this is, I think, probably a theme you're going to get from others and from us in this kind of increasing of the inequities that we already had. And I think someone sort of used the analogy of COVID being kind of like the great exposer of all the cracks we've already seen in our society, but really being exposed by COVID. So in this final study, 23% of families who were disadvantaged pre-pandemic, so that's a quarter of them, perceived their final financial situation as just getting by or worse, compared to only 7% who were those who were most advantaged pre-pandemic. And what's interesting for those families were that across the board, parents who had good social support pre-pandemic, so keying into some really important positive factors, actually did better during the pandemic. So that's kind of some tidbits from our actual cohorts. Maybe I'll share with you some of the work we've also done at a national level through the Royal Children's Hospital National Child Health Poll, which interestingly is able to track families over 3 time points, and really had a look at families in June of 2020, September 2020 and July 2021. And what's interesting there is that certainly in June 2020, this is after the first lockdown nationally, 1 in 4 families are already reporting job or income loss. And this is a representative sample. This is not necessarily poorer families, and 1 in 3 were reporting material deprivation. And then when we go forward into July 2021, almost 60% of Australian parents were reporting a negative impact on their mental health. Now, if you recall back in July of this year, both New South Wales and Victoria were in a lockdown. And of course, they're our most populous states, so that potentially won't surprise you, but they're always almost over a third were also reporting negative mental health impacts for their children. Again, this is also not surprising. Parents who are less well off reported worse mental health. So you're kind of seeing this theme here in both our cohorts and also in these national data. Interestingly, if we then go through to looking at some other national data that we've been involved with, which is called the Research Insights related to the tracking the pulse of the nation, which is work being done through the Melbourne Institute of Applied Economics and looking at families with young children and those who are reporting themselves to be just making ends meet or in financial stress. We've just reported on this recently, and really throughout the pandemic, if you look at it on average, 68% of families were reporting that they were in some sort of financial distress or not able to make ends meet. So that's like a lot of people. And I think we're going to keep coming back to this kind of intersection between mental health, financial distress, and how that impacts both children and families. Perhaps I'll stop there. There's some other things I could report on in terms of children who actually had COVID, if you'd like to come back to that later.
I wouldn't mind if you could just, before I hand the call to someone else, I wouldn't mind if, hearing what you have found from, I think you call it the mental health impacts for children who experience COVID directly.
Correct. So this is kind of really interesting. So this is the kind of, I guess, an indirect direct effect. What we're really finding is that there is a few parts of the process that we perhaps underestimated the impact on children. So this is a study that's looked at 342 children and their families and surveyed them and interviewed 15 in depth. And there are some trigger points that I think is worth thinking about. First of all, the actual getting tested themselves, that for some children and families, this was really distressing. So some of this was back in 2020 when it was all pretty new. Yeah. And then the actual shock and confusion of receiving the diagnosis. And I can tell you anecdotally, just from some of the work that we've been doing in schools in Victoria, that keeps going, the shock and confusion of actually getting the diagnosis, and an extraordinary amount of guilt. I've got it. Who have I given it to? Have I let everybody else know? And children actually saying, have I made my parents sick? So this kind of amount of, and we saw this from some data also from the UK. And then, of course, coping with isolation. So 14 days, and you can imagine what that's like for some families where there really isn't the opportunity to get outside at all. The contact they were having with the public health workforce at the time, and then the stress of moving forward out of that. And the kind of, for some families, some level of trauma and anxiety about, well, what does it mean now? Am I well? Who else could I give it to? But the overwhelming kind of ideas that are emerging from this is this idea of stigma that perhaps we had underestimated. What does it actually mean to get COVID? So we've spent a lot of time talking about the fact that children are actually pretty well, which is great. I mean, I don't think anyone should underestimate the extraordinary outcome that is that children are actually quite well with COVID. But those who get COVID, even though they're well, they are experiencing this sense of stigma. So, there are these perhaps unusual indirect effects that we hadn't thought of previously.
Thank you, Professor Goldfeld. I'm nodding furiously at all of that as having been a family who's gone through exactly that circumstance. Can I hand now to Senator Patterson?
Thanks, Chair, and thank you very much for appearing to the witnesses for appearing before the committee today. Just want to revisit briefly some of that evidence you gave in your opening statement, just to emphasise the relatively minor effects on young people of COVID, because I think that is really important. We saw when Victoria and New South Wales started to open up again that there were those who said we shouldn't rush it because children are unvaccinated and we need to continue to protect them. Is it necessary, in your view, to continue to lock down even though children are not yet vaccinated?
Thank you for your question, Senator Patterson. I might begin by answering that question to speak a little bit more about some more information we've got around the direct effects of the virus. This is something that I'm very passionate about. I'm really passionate about getting good quality data in children around the effect of the direct effect of the infection, which I guess I like to highlight that I feel like we could do better at. As a paediatric infectious disease physician, I'm involved in the direct care of children who have COVID. So I see children who have, more severe respiratory infection that requires oxygen, requires treatment and occasional admission to intensive care. I also see children with MIS-C, the multi-inflammatory system syndrome associated with COVID as well in children. And I'm sort of broadly interested in long COVID as well. So I've got some personal experience, and then I think more recently we're starting to get some better Australian data. And so we have a recent report through the Australian government with their weekly epidemiologic reports, where we're starting to get some of that data broken down by age group, which I think is incredibly helpful. It's been missing up until now. So I did want to just share some of that information with you. It just sort of highlights some of the issues here, I think, and some of the sort of differences between jurisdictions. So the most recent report, epidemiologic report that I have available was to the 24th of October, but that only reported paediatric data broken down by age group to the 10th of October, but we can go back 6 weeks prior to that from the 30th of August. So there's three sets of fortnights, if you like. Over that period of time, over that 6 weeks period from the 30th of August to the 10th of October, there were 79,000 positive cases in Australia, of whom 21,000 were children, about 26% aged under 18 years. There were 636 children admitted to hospital, so that's 3% of that 21,000, and 12 children admitted to intensive care in that 6 week period, so 0.06% of the 21,000 children, and there were no deaths. Of note, during that period, there were over 1,000 adults admitted to intensive care. So the data, I think, are very interesting. And one thing that does tell us a bit of a story is the change over time from the 30th of August to the 10th of October. And we've seen a gradual reduction fortnight by fortnight of the proportion of children who've been admitted. So in that first fortnight, 4.4% were admitted. And by the time we got to the last fortnight, so coming up to the 10th of October, 2.1% were admitted. And I think this reflects a couple of things. It may reflect some vaccine coverage, but it also reflects the different ways children are managed with COVID in different jurisdictions. So in New South Wales, where it's been pretty clearly reported around 5% of children admitted with COVID, many of those children are admitted for social care because their parents are unwell, or they're admitted with COVID rather than for COVID. In Victoria, the situation is different, and children who are admitted tend to be admitted because they require medical care. And interestingly, during that first fortnight period, around 80% of the cases around Australia were in New South Wales, and by that last fortnight period, around 70% of the cases were in Victoria. So I think it's sort of starting to tell a story. And my view is that probably what is really happening is similar to what we're seeing in Canada, which is pretty consistently seeing that around about 0.07% of children require intensive care, and around 0.7, so less than 1%, require admission to hospital. So why is that important? I think it's important in just being clear around the actual proportion of children who do become sick. And I think it's also important because I believe that we need some better data to track the situation for children, because we've got gaps in age group data, we've got gaps in severity in terms of kids who require social care, kids who require admission to hospital in the home, and kids that are actually diagnosed with COVID. And we also need some information around vaccine status as well. So I think, as a researcher, often the answer to many questions is, some better data would help us be able to inform decisions and policy making better. I'll leave it there.
Thank you. Very helpful to have that factual information on the record, and I certainly don't want to diminish the experience of having a child admitted to hospital. That's not a pleasant thing, but that is relatively encouraging numbers based on the figures we have, and I appreciate your call out for more data on that. Moving on to vaccination in children. Again, you've already addressed this partially, but just for emphasis, because it's really important for people to understand, that the data that we do have so far appears to indicate that the vaccine is effective in children and is safe for children. Is that a fair summary?
Yeah, so the information we have for the 5 to 11-year-old group indicates that the vaccine is effective in the small trial. We're going to get more real-world data over the coming weeks to months, where, as I mentioned previously to Senator Gallagher, that we'll have more detailed information around safety. So it's hard to say with confidence around safety in a small trial, but having more confidence in a large trial. And I think it's important to say that the situation in the US is different to the situation here, where all of the things that we are doing so well in Australia, protecting our children through vaccination of adults, vaccination of teachers and caregivers, aiming to provide ventilation and other vital COVID-safe measures in schools, is different in the US. Many of the states in the US have much lower vaccination rates. So, the sort of urgency around vaccination of children is increased in the US, in parts of the US.
Yeah. And just finally, on the issue of long COVID in children, I'm interested in what evidence we have about the effects of that at the moment, and also whether you can comment on what impact vaccination has on long COVID symptoms.
Yeah, this is a really important area, and I think, Senator Patterson, that the answer again is probably we need some more data. So I think that we spoke to this at our last meeting with the Senate Select Committee, and we're still really looking for more information on long COVID. I think what we can say with some confidence is that long COVID is less common in children and adolescents than it is in adults, and that all children will have some persistent symptoms after any viral infection, and exactly the nature of that for long COVID is not clear just yet. So we continue to look for those data. In terms of the vaccine and its efficacy against long COVID, that is not well known, except to say that you need to develop COVID. You need to have COVID to get long COVID. So if the vaccine is preventing COVID infections, and it's also preventing long COVID as well.
Okay. All right. Well, any additional information you could provide on notice about the impact of vaccination on long COVID, I'd be really interested in children and adults. I was advised that there had been some preliminary or early studies showing it might have a positive effect on long COVID symptoms. Anything you could provide on that would be really useful.
Be very happy to take that question on notice. Thanks, Senator Patterson.
Professor, just before I hand...
Thanks, Chair.
Thank you. Sorry, Senator Patterson, to cut you off. Just before I hand the call around, what about for kids that have tested positive to COVID, then getting vaccinated? Is there a view? I understood it to be 6 months. Originally, there was a view that it was 6 months post-diagnosis, but has that changed?
I believe that advice has not changed, Senator Gallagher.
So for those of the kids that have had them in the outbreaks in Victoria, New South Wales and the ACT, the advice is to wait 6 months. Yeah, okay. Senator Cox, did you want the call, or Senator Lambie? Senator Cox, I'll go to you first. Yep.
Okay, thank you. I'm just really interested in the research that you've done in relation to the mental health impacts on children. In particular, findings for First Nations children and from the CALD backgrounds. Are you able to talk to that, either one of you?
Thank you very much, Senator Cox, and it's a really important question, and I might hark back to my original lament of us having insufficient data. I think Professor Steer and I are going to have this kind of ongoing talk about more data. But I do want to say that not in a kind of trivial way, oh, we're researchers, we just need more data, but really to fundamentally kind of put this into a kind of policy, what I think is an important policy question, which is how does the system respond as we move through the pandemic and post the pandemic, and try and understand. I did catch the tail end of the previous conversations about what are the kind of impact of resilience, so which kids have actually done quite well and are thriving as we move out of the pandemic, and which kids are not, and how we're going to know that, and how we're going to have the right sort of precision to our policy response to be able to sort of more accurately target our resources to that point. So to your specific question is, I don't think we know the answer to either of your questions quite yet at a population level. And that's because of a couple of reasons. First of all, many of our studies, sadly, have not included sufficient numbers of Aboriginal or COL children to necessarily, in sort of our studies, and that's a lament of ours, and it's a much longer conversation as to why research studies have insufficient data on these children, so that we're unable to sort of put hand on heart and say this is what's happening for these children. And the second is that that's actually a ubiquitous issue across the whole country, that there are a number of these studies that lack these data. So I'm not aware, but I'm certainly happy to take it on notice and see if there's anything further we can find. Probably more likely on children from diverse cultural backgrounds, and specifically for Aboriginal and Torres Strait Islander children, just because that's the nature of the research agenda. But I'd be very happy to come back to you. We did have a very good scout around the research before we came on here, and really couldn't find anything substantive in Australia, at least.
Yeah, I think that's probably a very big gap then, and if you don't have any sufficient research in this area, that we should be looking at that, particularly given that we do have a Closing the Gap target, and particularly around the importance of education and what the previous witnesses gave evidence to, if we are talking about particularly the short and long-term impacts of COVID and mental health statistics that we do know the impact on First Nations children, in particular suicide ideation and others. It's quite troubling that we don't.
Can I just follow up, Senator, just say there are two data sets that haven't been released yet that I think will be of interest to you. One is NAPLAN and the other is the Australian Early Development Census. So you'll know that NAPLAN has been released at a state level, but although states have probably seen the breakdown by subpopulations, priority populations, disadvantaged, local breakdowns, that hasn't been released to the public. But I guess as senators, you might get access to those sort of data, and I think that will be a very interesting place to look at. And the other is the Australian Early Development Census. For those of you who don't know, that's a measure of early childhood development that gets completed by all children, gets completed by teachers on all children starting school. And it just so happened it's a triennial collection. 2021 was the collection. So that collection's been completed, and those data are available again through the Federal Department of Education. So training or skills and employment, I should say, DESI. So again, I think those are two very important data sets that we do have at a national level that I think will shed some light on some of the issues that you're interested in.
Great. Just one final question. I know that you did talk a little bit about some of the vaccination risks to children under 12. Did you want to expand on that, and also some of the benefits of vaccinations for children under 12?
Sure. So maybe I'll start with the benefits, and thank you for your question, Senator. The benefits are could broadly be divided into, number one, reducing the risk of disease for children, so for their health directly. And I think that is reducing the risk of hospitalisation, acknowledging that hospitalisation is not common, but it still occurs, and caring for these children myself. I, have seen children who are sick with COVID, and prevention of that is important. The second aspect of that is, some of the things that Professor Goldfeld has spoken about in terms of the indirect direct effects in terms of the, the stigma and the other aspects that Professor Goldfeld has discussed. That's the first area. The second is in allowing and helping for children to remain engaged in all the things that we feel so strongly about. So their schooling, their play, their team sports, so that vaccination, keeping them well, keeps them in their essential business, really, of kids, which is really important. And the third aspect is, the greater proportion of the population who are vaccinated, the less transmission that we see across the community. So that's the way I conceptualise it in those three domains. In terms of the risks, I think it's important to say that the COVID-19 vaccine that is currently being rolled out in the US and Canada, which is the Pfizer mRNA vaccine, is broadly safe, has been very safe for adults and adolescents, so from 12 and up. The side effect we've been most concerned about is the side effect of inflammation of either the heart muscle or the lining of the heart, so myocarditis or pericarditis. That seems to have peaked in sort of the 16 to 25 to 30-year-old group. It appears to be a little less common in younger adolescents. And so there's every reason to think that it may even be less common in children aged 5 to 11, also because the dose is 1/3 of the dose that's provided to the 12 and up. But we don't know that until we have sufficient data. And I think that's the point we've been making today around just exercising some caution as we get more information about adverse events in the US and Canada. And both of those countries have excellent adverse event surveillance systems. And we have excellent relationships with many of the authorities that are involved in that surveillance, and we'll have that information as it becomes available.
Great, thanks, Chair.
Thanks, Senator Cox. Can I just ask another question? The paediatric dose of Pfizer, is that able to be adapted from the supplies that we have, like the adult doses, or does it come purpose-made for paediatric population?
It's thank you for your questions, Senator Gallagher. It's a purpose-made vial, so and that's also a really important thing that speaks to making sure that vaccines for children are dosed safely. So different formulation, different bottle. Yep.
Right, thank you. I'll go to Senator Sheldon and then Senator Lambie. If you have questions, I'll come back to you.
Good, thanks very much, Chair, and welcome Professor Goldfeld and Professor Steer. I just want to go to this question about the transmission of COVID and anxiety, of course, that can occur across a family, so there's mental health questions there. But critical question, with Christmas coming upon us, should parents be worried about their unvaccinated kids hugging grandparents? Professor Steer.
Yeah, no, thank you for your question. I think the critical aspect of this is just the importance of vaccinating grandparents and the importance of encouraging a third dose or a booster, as some people call it, as the time comes 6 months after your second dose of the first round of vaccines, I think is absolutely critical. Transmission, I think one important aspect of your question, I think you've touched on transmission in the household, which is where most transmission occurs. And Professor Goldfeld may want to speak to some of the efforts that have been done within the school and early child education setting. I think it's important to speak about that transmission in the school setting tends to be are less important than transmission within the household. So, and I think that speaks to our view and our feeling about the importance of keeping kids at school and that we can do that safely.
Thank you for that. Professor Goldfield, do you want to add anything to that?
I mean, I think your question is really well taken in that we are moving into Christmas, and we also are moving in pretty much across Australia into families being able to get together in all sorts of ways. And for children, that's so important for their mental health, as well as for parents and their mental health. So I think to be able to do that in a way that's both safe and sensible is really important. As Professor Steer said, the number one strategy for keeping children safe is to vaccinate the adults and adolescents. That is the number one, maybe 2 and 3 strategy. And so ensuring, and we say this knowing that there are still pockets of the population that are under-immunised, and I know there are efforts going on across Australia to ensure that those pockets are also immunised. So that's really the main strategy. And then moving into other platforms such as schools and early childhood education and care, it's what we call layered mitigation strategies, taking into account exactly what Professor Steer said, which is that most of the transmission does occur in the community and in home. But in schools, what we're seeing in those layered mitigation strategies is still number one, the vaccination. But now we're talking about vaccination not only of the parents, but also of the staff and all staff. And that's obviously been implemented in different ways in different jurisdictions, and then together with other layered mitigation strategies, such as looking at ventilation, everything from opening doors and windows right through HEPA filters, etc., sort of having kids go have staggered lunchtimes, etc., staff, not being in the tea rooms, trying to give kids more time outside, etc., etc. All of these things are designed to try and minimise any transmission possible, and some of these kind of ideas have also come through the latest Doherty report that was presented to the National Cabinet about the opportunities for testing regularly, either testing regularly and or test to stay. The idea that, remembering with that modelling, the outcome was kids being in school, not transmission, but kids being in school as the kind of number one outcome. And to do that, that means doing something called test to stay potentially, which is if there is an exposure to a case, the kids get tested on a daily basis at home and then only come to school if they're negative. So that's kind of been thought about quite deeply for schools. I think there's still a gap for what we might do for early childhood education and care and younger children. And I think that's something we might need to turn our minds to collectively over the next little while, so that we can give similar guidance to early childhood education and care.
Just a last question from me, but so parents that have hesitancy or concerns about vaccinating their children, what's the sort of advice you'd give to them? What key considerations should they be having? Professor Goldfield, if you want to go first.
I was actually going to hand over to Professor Steer, because this is really his area. What do they call it? That's not my swimming lane.
No, that's great. Thank you, Professor Steer.
Yeah, no, thank you for your question, Senator. This is a really important area. Interestingly, we are seeing, from just as a quick aside, we are seeing tremendous uptake of vaccination from adolescents over the past few months since vaccination's been available. And I just think I just wanted to flag and give a shout out to, the teenagers of Australia who really have, I think shown many of the adults the way about their enthusiasm for vaccination. So I think that the key messages are around the experience we've had with these vaccines in adults and the safety profile, the information we'll have around safety in these vaccines over the coming months, the potential benefits, the very long history of, most vaccines in Australia are given to children. It's an exception rather than the rule that the focus of COVID-19 vaccines have been in adults before children. And then I think the last thing I'd say is, and I'd probably tip my hat to my colleague, Associate Professor Margie Danchin at the MCRI, who this is her area of expertise, is for healthcare providers to be able to take the time to listen to families' concerns about vaccines and be able to answer those concerns with very clear information and to enter into a conversation because it is an important decision for families. I think that conversation with doctors and other healthcare providers is absolutely essential for those parents who may be vaccine hesitant.
Thank you, Professor Steer.
Thank you, Senator Sheldon. Senator Lambie, do you have questions?
I do, thank you, Chair.
There you go.
I've had people out there asking me this. I think when COVID first started, there was about 20% where you said would actually get it, wouldn't really have much of a reaction to it. They're now worried about their kids, especially their young kids. Is this going to be another vaccination lineup at 9 months old, 12 months old? And they want to know, is there any test at the moment to say whether or not you actually have got enough immunity against COVID without sticking anything in your arm? Is there a test at the moment to say, actually, you don't need it because your immunity will already be resistant against it?
Thanks for your question, Senator Lambie. No, there's not a widely available test. I think that having except to say that having a positive test for COVID tells that you've had COVID. That's the first thing. And being vaccinated for COVID tells you that you're immune to COVID. And that as you approach the 6 months period after your second dose, then you should be arranging for yourself a third dose or a booster. That's where we are at. I think that's the appropriate approach that we're taking.
With those booster shots, I've also got people out there saying, well, I've had my 2 shots, I don't have my freedoms back. What was the point? Are you getting any pushback, or do you expect pushback from that for that booster shot? Like, if we haven't got our freedoms back, we're shoving vaccinations in us now, then you want to put a booster in, but we still haven't got our freedoms back properly. Is that going to be an issue?
I think, thanks for the question. It's a very interesting question. I think that looking across to what's happening in Europe as they're coming into their winter is really instructive. So I'm sure all of the senators are aware of the increasing cases in a number of European countries. And I think that is speaking to the importance of boosters. And I say booster, and I probably should really be saying third dose, because I think that we're learning that the sort of vaccine course that's needed for COVID is the three doses. And I think that if Australia can get to a situation where we enjoy our summer, we enjoy our time with each other over the Christmas and holiday period, and we're getting our third doses, and potentially children start to be vaccinated, that we can approach winter with an immune population that's protected from the virus. I think that's everybody's hope, that we can reach that point. And that obviously provides us with those freedoms that you spoke to, Senator Lambie.
Okay, I have no further questions. Thank you.
Thanks, Senator Lambie. So just projecting forward, it sort of goes from where you just finished, Professor Steer, that the importance is really getting the third dose, and children pending TGA and ATAGI approval, or pending TGA approval and ATAGI advice, that this be done sort of in February, March next year at the latest. I mean, because my reading of the Northern Hemisphere is that the minute the cooler weather starts, autumn, really, you start seeing a rise in cases. Should we be preparing for that next year?
Thanks, Senator. I'm not sure it's necessarily my position to sort of advise on that, but I think that they are important considerations. And I think that, learning from the European experience, including a number of countries with high vaccination coverage, is important for us to think about and to be prepared for. And from our perspective as paediatricians, doing all we can to keep kids in school is really front and centre for us in keeping kids engaged in their normal lives.
Yep. Absolutely. And just finally, if people have a final question, please let me know. But from my point of view, I think one of the issues for parents with unvaccinated kids who are unable to access a vaccine at the moment, in sort of the approaches that I've received over the last few months, is that you just don't know how COVID will affect your child. Like, I think most people understand it's a mild illness in the vast majority, but, it does make children unwell and some get severe symptoms. So I think, what reassurance, I guess the evidence and the numbers say are what we point to provide reassurance, I guess. But the other pressure I get, or question I get often is, how do I care for my child at home? What do I need, and what do I need to look out for? And is there something that you could, or is there some evidence you could provide the committee that kind of outlines or addresses that? Sorry, it's a big question, I know, and difficult for a doctor to answer. But I think that they're the two things I get is I'm not sure how it'll affect my kid, and I don't know how to look after them. Basically.
Yeah, no, thanks, Senator. I think it's a really important question for parents, and it's a very practical and pragmatic question. And I think that many of the maybe I can speak from my experience in Victoria from my perspective, and the pathways care pathways that have been established by Safer Care Victoria, and having hotlines to call. Having a streaming process so that parents who have a child who has a positive test have a health expert to speak to. I think that has been really important. And going through on the phone or on Zoom, using virtual communication methods, looking out for any concerning signs about when you may need to take your child to the emergency department. Having hospital in the home systems in place where children who are a little bit sick but not sick enough to be in hospital, because we try and keep kids out of hospital, they have nurses from the hospitals coming out checking on them every day. And so I do think there has been a fantastic clinical response and care of children in the community who have tested positive for COVID. And I commend those that have had their shoulder at the wheel doing all of that work. I think it's been really remarkable.
Thank you very much. Senator Sheldon has a final question before we let you go.
Good, thanks. I just want to deal with a question of potential variants down the track and their potential impact on children. And it is, this is a difficult question as well, but from variants, the likelihood of variants from here or overseas down the track, and is there a sort of a timeline of concern that would exist that the variant might come along? And I'm particularly mindful that obviously large swathes of the world population haven't been vaccinated.
Yeah, thanks for the question. I think I'll answer that question by saying it's a little bit perhaps out of my area of expertise, and I'm just wary of stepping out of my lane in regards to variants. But one thing I would say is just the importance of taking a global approach to vaccination, and I'm sure all of you are very aware of the inequities in vaccine coverage. Some of our close neighbours in particular have very low vaccination rates. And where people are unvaccinated increases the risk of the emergence of variants, and that's probably about all I can say on that, Senator.
Well, thanks, Professor Steer. I appreciate having a gallant go at it.
Okay, I think that's it from. had from questions, can I thank both of you very much again for appearing before this committee and for the incredible work that you're doing, caring for children and, you know, providing fabulous research to help guide policymakers through this pandemic and prepare for the next. So we really do appreciate your time very much. I don't want to say we won't see you again before the committee, but I also don't. We love having you, that's all. But we'll...
We're always delighted, Senator.
Yeah, thank you so much. We do appreciate it.
Thank you, Senators.
Thank you.
Aye.
Colleagues, we may suspend now for a short break. We've got the Minaroo Foundation at 11:30, so if we reconvene then. Thank you. I'll resume its hearing into the Australian Government's response to the COVID-19 pandemic. I now welcome the Honourable Jay Weatherall from the Minaroo Foundation's Thrive by 5 initiative. Mr Weatherall, would you like to make a short opening statement before I hand over to committee members for questions?
Yes, please. Well, thank you, Senators. So as I think you've been informed, I'm CEO of Thrive by 5, which is an initiative inside the Minaroo Foundation. Now, I'd like to thank Senators for the opportunity to address you today. I'm coming to you from East Fremantle, which is on the lands of the Wadjuk people, part of the Noongar Nation. I'd like to begin by joining all those who I think have already given evidence to the committee calling for a COVID children's plan. But the particular focus of my evidence is going to be the early years, which is the focus of our initiative. So the first 5 years from birth to 5 years of age. The context, of course, is that those first 5 years are absolutely crucial for the development of children, both their health, learning, behaviour and emotional trajectory. Much of that is established in the first 5 years. And while this is relatively new knowledge, but only in the scheme of things around the last 30 years, we've now understand that it's the interaction between high quality early experiences and the genetic endowment which creates capability and sets up children for the rest of their life. So much attention is really placed on school and the things that happen after school, but so much of the health, wellbeing and learning trajectory is established before children walk through the school gate. And so that's really the essence of the focus of the work of our foundation. But it has a particular relevance in the context of COVID. While it is true that the rates of illness, hospitalisations and death are lower for children under 5, they can still catch and transmit the virus. And there is emerging evidence that younger children are about 40% more likely to transmit COVID than older children. And what we know is that because of the vaccinations that are now going to be rolled out eventually to children over 5, the largest unvaccinated population, about 39% of all Australians, will be under 5. We also know that 1.3 million children use early childhood education and care services each year. So those services will have large numbers of unvaccinated children mixing on a regular basis. So when you add all those things to the other effects that COVID has been producing, so stress that emerges at home through people dealing with lockdowns, the financial pressures associated on families, the particular way in which we fund our early years services, which are subsidy-based services, which means that they are apt to the financial pressures associated with children that can't attend because of isolation requirements or lockdown requirements that are imposed on those facilities. You see a pretty patchy and chaotic offering of services to children in those first 5 years. And what it really means is they're missing out. They're missing out on early learning opportunities. They might be spending more time in a slightly more chaotic home environments. This is likely to have a worsening impact on those families that were already experiencing inequality. So that's the big context for what we're talking about. So the response that we've seen so far in the early years has been uncoordinated. There's no agency that's been responsible for creating a coordinated national response for children generally, but certainly for children under 5, nor monitoring the effects that this pandemic is having on that particular group of children. And it's not informed. We know that the Doherty modelling, which has been used to guide public policy makers around the nation over the last couple of years, hasn't actually been undertaken in relation to under 5s. It's been excluded from the work of the Doherty Institute, simply because they haven't been resourced or asked the question. So this really speaks to a broader issue about the lack of institutional arrangements for the early years. I can tell you from bitter experience that there is no one level of government, even one agency, that thinks they're responsible for birth to 5. You couldn't find a government agency that says that we're responsible. There is a generalised view that the responsibility sits somewhere between parents, between states, maybe a bit of education, depending on the children, child protection, infant maternal health, perhaps for a while. There is nobody that sticks their hand up and says, I'm responsible for the first 5 years. And it's not surprising we don't have a coherent plan for the early years. And given how crucial the early years are, this should be the very first plan that should be put in place, not the last plan that's put in place. Because the real risk is we have a generation of children that actually miss out on their early learning opportunities, and in particular, that crucial first year before they attend school. So what are we calling for? Well, we want a children's plan, and the particular focus we have is on the early years, and we think there are 3 critical areas there. One is greater support for children, and in particular those children that miss out. So some arrangements to make up the hours that they might be missing out on, and maybe some special remedial measures in the early years of primary school for those children who can't make up the 600 hours that they're meant to be guaranteed in the year before school. Similarly, in relation to children in terms of their early learning opportunities, there could be arrangements put in place that ensures that children that have missed out on those early learning opportunities have make-up time or additional hours, which may require additional levels of subsidy. So the second broad category is health support, vaccination priority for early childhood educators and others working with children. We know that this is a population that is unvaccinated and for obvious reasons are difficult to separate children and to have them conduct themselves in a way which might be possible at schools. The third issue is financial stability support, and this really goes to this question of a lack of a system. During COVID, we've seen that the ECEC system or childcare system fall over 2 or 3 times and has had to have emergency measures put in place to respond to it. And this is not the first time this has happened. About a decade ago, we saw the ABC Learning collapse, where about 100,000 children were, for a period of time, had the possibility of losing their access to early learning. So this is a system which doesn't have security. It's a fragile system. COVID has, I think, drawn attention to the fragility of the arrangements we put in place for the early years. And when you consider this most recent set of lockdowns and the reality that Delta will continue to cause disruption, we need to have a package of financial stability support to ensure that families and those service providers are able to continue to provide their crucial services. It is fair to say that the Commonwealth did respond on the 9th of November with a further set of measures which largely swing around not charging the gap fee for some families, but while that's good for families, it puts real pressure on some of the service providers, because just because the families aren't paying their half of the childcare fee, it doesn't mean that those costs go away. Indeed, some of the costs are even higher because of the nature of the special arrangements that need to be made in the ECEC services to meet the hygiene and other requirements. So there needs to be attention to those three matters: greater support for children, health support, and financial stability support. But the big answer in the long term is a universal, high-quality early learning system which looks and has the stability and support that we sort of witness in the school-based system. So schools haven't fallen over during pandemic, whereas early learning and childcare centres have. And that's because we don't have in place the sort of arrangements that really pay the proper privilege to the importance of the work in those early years and the critical effect that it has on the health and well-being of our children. Thank you very much, Senators.
Thank you very much, Mr. Weatherall. Can I start with a question really about how you would, what area do you see the federal government responsible for? Because this committee is looking into the federal government's response to the COVID-19 pandemic, and a lot of the issues facing children and young people, as you and I both know, fall across multiple layers of government, as you've pointed out in your evidence. Is there, is it leadership that the federal government needs to provide in this area, resourcing, and what is the first thing you'd do, and how would you drive that? Is it through National Cabinet, or are there, other ways to deliver what you're seeking here for kids between 0 and 5?
I think the first thing I'd do is make it a standing item on the National Cabinet agenda. this needs to receive the attention of First Ministers, because it cuts across so many different areas of responsibility. It's very hard for one minister to just look at this area without it sort of sticking their nose into somebody else's portfolio, which is tricky. But it's really only First Ministers that are able to actually make those calls. So it has to be on the National Cabinet agenda. And I think they should, the first thing they should do is commission a children's COVID plan, so that somebody has responsibility for pulling together a series of responses, because this isn't just, there's a crisis, at the moment there's a series of crisis responses, but we're likely to see the ongoing effects of this for some time. For instance, we don't yet know whether we'll even have a vaccine for under 5s. That will be the next thing, and that needs to be monitored. International developments on that need to be monitored, and that needs to be acted on quickly. There's at least 3 regimes at the moment for how you test children. There are different views about whether it's even a good idea to be doing that to little children. Victoria's got a regime. There's other regimes around the place. There's no national consistency there. So it is about leadership, I think. Ahead of actually creating the coherent system that we think is necessary, in the short term, you can use the mechanism of the National Cabinet to create that coordination.
And we've had evidence this morning, and I think you've touched on it in yours, around this idea of a national children's plan. In the first instance, you think it should be focused on a national children's COVID plan, or that it should be a subset of a national children's plan?
I think we've got enough to get on with in terms of COVID. I think there are enough big issues. Ideally there should be a national coordinated children's sort of strategy, but I think there are enough imperatives around COVID for that to be at least its initial focus. So I'd start there. It'd be a shame if this was just something that went off and we had to spend many months developing such a thing. I think this requires a sort of much more urgent response.
Can I also ask, it was raised this morning around consulting with children. It's probably, I don't know, with the 0 to 5s, it's perhaps less of a direct consultation. So it's probably, maybe it's a question for others. But do you have a view on best practice in terms of engaging children and young people on something like this?
I mean, I think, look, in terms of the development of the plan, I think that's probably a bit too much to ask, but I think any plan should have within it the importance of actually monitoring the mental health and well-being of very young children. I mean, I think there used to be this sort of idea that children don't have mental health. You know, they're sort of, you know, they're happy, they're sad, they're hungry, they're not. But now we know that critical sort of elements of trauma can be laid down in those early years. And so careful monitoring of the health and well-being of children in those first 5 years is crucial. And, you know, we're likely to have seen stress levels rise in families, which are going to have their own effect on the health and well-being of children. That's why there needs to be, you know, a specific attention given, I believe, in any plan to those first 5 years. And I think it really is. The other thing I probably should have said, the first thing the Commonwealth could do is to fund the Doherty Institute to carry out modelling in relation to the 0 to 5. I mean, it's inappropriate that hasn't happened already.
And finally, from me, before I must hand the call on, and you've sort of finished where my question begins again, is data collection. So yes, Doherty is part of that, but I think, again, other witnesses and submitters to this committee have drawn our attention to the fact that there isn't consistent data collection of children's experience with COVID, and that states perhaps collecting things, different indicators and reporting differently. Is that an area that you think the federal government could be more active in?
Yeah, and there's a real opportunity the federal government has. Federal government is likely to be holding data already about the AEDC. It's already been collected. It's possibly in the final stages of collation, and that would likely reveal some very interesting things about the experience of children. So this is a rare database. It's the only country in the world that measures the development of children at age 5 across the whole country. A number of countries have got it in regions. We're the only country that actually collects it on a nationwide basis, which gives you the opportunity of comparing, say, Western Australia with a Victoria and see the different experience of different 5-year-olds. So that data is available right now. I don't know it hasn't been released publicly, but it's certainly something that I think senators would benefit from understanding, because it would inform, I think, a lot of policy or public policy making.
Okay, we might definitely follow that up through the committee. Can I hand now to Senator Patterson? Give you the call.
Thanks, Chair. I don't have any questions right now. I may have later in the hearing, depending on how it...
Okay. Senator Lambie, you've got questions? I can see a finger waving. I hope that's a question. Or you're telling me off, one of the two. You've got the call.
Yeah, good morning, Mr. Weatherall. Thank you for coming in. I have to say that you're with Minderoo, and Twiggy Forrest has already done a fabulous thing on this from the Forest Foundation, and that would be this, mate, called Creating Parity. Spend millions on it. Wonderful book. I think a lot of your answers are actually already sitting in there, to be honest, apart from any COVID stuff. But really, the federal government really needs to have a good look. We had this wonderful thing out there called the cashless debit card. They've screwed it up. There's no other way to put that. That could have made significant difference in where we're heading with the most vulnerable in society in the future, and they've stuffed it up. Even they'll admit that themselves. That's why it's going wayside, which really makes me quite sad. But the effects of that, from the mother being pregnant to her being vulnerable to making sure she knows how to cook, to look after the child, to installing values in the child. It's all there. It's actually all there, Mr. Witherell, and it makes me really sad that, you know, I'm sure you know you don't have to reinvent the wheel. It comes down to the will of the government, and it's just not happening. I don't know if you want to say anything about that. I'm sure you're across that creating parity stuff. It's got no reflection on what colour skin you've got. You know, like when I first started out with Twiggy with a cashless debit card, I said, it's fine, I'll jump on board. But it's not just for the Indigenous, it's for everyone. Everybody that's in those vulnerable situations that have got kids, where their kids are not getting fed, all that sort of stuff. It doesn't just happen in the black community, it also happens in the white.
Absolutely. Thank you, Senator.
It's really laid out there, isn't it, mate? And they're just not using it.
Absolutely. I mean, I think critical to all this, the big backstory to all of that is the whole notion of empowerment, making sure that you actually empower parents with both knowledge and responsibility. They're the critical elements of that whole plan.
Do you see more, so you're looking at more hours in those childcare centres, especially for the most vulnerable, to take them out of those sittings or those settings during the day, give them some rest? I think it's getting worse out there, Mr. Witherell, and I say that because I'm seeing a lot more homeless out in the street.
Yeah.
Those kids are going to pay for that. The housing prices are going through the roof. I cringe to think what it's going to look like for the homeless in about 2 or 3 years' time.
One of the sort of paradoxes of our childcare system is that it's not really made for disadvantaged families. It's actually made for people that are going to work. And while theoretically people that don't work can access it, the hurdles to jump over are actually very difficult. And it's all a bit about, because you've got to sort of show that you're looking for a job before you can use the childcare, whereas you actually need the childcare to be able to get yourself organised to be able to look for a job. So it's the activity test, I think, is a bit back the front. And the effect of that, say if you're a single mum, it's very difficult to access the childcare system, leaving aside the financial disincentive. It's not, because it's set up for working parents largely. It doesn't look like the sort of place that's always that welcoming for sort of people that might be coming from slightly more chaotic backgrounds. So what you've got is this paradox, is that childcare would most benefit the families that don't use it. So and this is during COVID. Actually, what was interesting, the experience that we're seeing anecdotally, there was a bunch of people that used childcare for the first time during COVID because it was free. And they hadn't really ever thought it was for them, and the hurdles were too high, so they started using it. And actually, some of the services are saying they've seen people they'd never seen before come in, which was beneficial. So, I think this is we just need. The short answer to your question is yes. I think we need to find ways of actually providing additional support for families so they can gain access to the early learning opportunities.
Yeah, because I understand what people are saying, well, why should we allow kids, because parents are too goddamn lazy to go to work, they've got drug and alcohol problems, why should we be doing that? And I'm sure that you've already realised the only way to break that generation to keep feeding like that in the future is by doing something dramatic as letting them go to school so they've got that respite during the day away from their parents. As awful as that sounds, but quite frankly, I don't have any other answer either. So I would like to see those most vulnerable kids out there having that 6 or 8 hours a day away from their parents that are like that, so we can try and break that cycle, because I don't know how else we're going to do it.
Yeah, I think we've got to rethink how we see childcare. It's really now, increasingly we're starting to understand that it's about early learning. It doesn't mean that we're outsourcing parenting. It means that parents are still going to be a massive part of the whole system. It's just that some parents actually are going to need that respite to be able to get their own lives organised.
Thank you. I have no further questions. Thank you.
Can I go to Senator Cox?
Thank you.
Thank you, Mr. Weatherall, for appearing this morning. I've got some questions just to get some more understanding of the Thrive by 5 campaign. What are the key goals of Thrive by 5?
Universal high quality early learning in a nutshell. And what that means is, I mean, the early years are really quite complicated. You've got infant maternal health, child protection, childcare, preschool, community and family services, and they're all spread all over the place, Commonwealth state responsibilities. There are significant gaps, basically, that exist in services, as we've just been discussing. So there's no coherent early childhood development sort of framework, either at a national level. Some states do have them, but because the states and the Commonwealth are such a big, deal, and they're both involved, if those systems aren't talking to one another, you keep seeing gaps. So basically, we think a great system is universal, so everybody that needs it can get it. It's high quality, which means also looking after the, valuing the early educators more than we do at the moment. It's integrated, so all of these various things are integrated at the level of the neighbourhood, so it's easy for families. It's place-based, so it needs to look like the community in which it operates. So, Bidjadanga is going to look different from Peppermint Grove. Like they're going to be very different sort of, needs in those areas. And then fifthly, it needs to be accountable. Somebody has to stick their hand up and say, it's our responsibility. And we think that's probably likely to be, education, state-based education systems, because they're the ones who ultimately are going to have, these children are walking through the school gate at age 5, and they're the ones that have to address all of the challenges of what hasn't happened in the previous 5 years. So we think that visibility, it's about creating visibility from 0 to 5, and create a service system which actually provides for all those needs.
Okay. And how are you evaluating the goals of Thrive by 5?
Well, whether we win, we want both major parties to go to the next election promising universal high quality early learning, and we want to then build that out. And they don't have to do it overnight. I mean, there are steps along the way. I mean, we saw at the last May budget, the Commonwealth made some steps to improve elements of the childcare system. I've seen federal Labor promise to go further, and also promise an integrated framework at the national level. So we want the current Commonwealth government to match that. We want both major parties going to the next election promising reform in this area. So, but there are steps. You could parental leave could be expanded, subsidies could be improved, infant maternal health, nurse home visiting could be made more comprehensive, and also targeted for disadvantaged families. So there's a whole, you could build this system out in steps, but what you really need is somebody to step up and take responsibility. All of the big reforms in this country have only ever been led by the Commonwealth, the Medicare, NDIS, like you really need a Commonwealth to stick their hand up and say, we're going to play a leadership role, even if the delivery resolves to states.
On your website, you've noted that Thrive by 5 is a grassroots campaign. How this initiative embodies the principles of grassroots campaigning?
Yeah, so we meet, we're pretty open book. We've got 72,000 supporters that have signed up to our website. We have about 50 people that meet every Thursday where we talk about the campaign. And I mean, it's not really our campaign. We're just bringing the campaign together. There have been people talking about this for 20 or 30 years. And we're just trying to bring all these voices together into a single unified campaign. So we've been putting, I know myself, when I was in the job, I tried to put this on the national cabinet agenda, and, would COAG agenda as it then was. And, it would get there, but it would slip away. really the people Nicola and Andrew Forrest have similar experience. They've been talking about this for 20 years. They started their philanthropy journey with the Australian Children's Trust 20 years ago. And they like me, got to the point where we thought, we've got all this powerful evidence about the critical nature of the first 5 years, but why aren't governments acting? So the gap between what we know and what we do just remains. And so I suppose where that led us was the idea that we needed to campaign. We needed to campaign and actually put this on the political agenda. So that's what we're really doing, is bringing together a whole bunch of people who've been really talking about this for a long time in lots of different ways, whether it's nurses, social workers, teachers, community activists. There's been a lot of people talking about this for a long time. We're just trying to bring it together in one single campaign.
Right. Do any of your policies and programs, are they specifically for First Nations people?
Not specifically. We, although we're informed, obviously, by the experience of First Nations people, and it informs our system design. So the system, obviously, when we say universal high quality early learning, that's easy to say but hard to do. We're actually also working away with a range of experts, including representatives for First Nations communities, to actually make what does that look like on the ground. And before, when I said what a great system looks like, I mentioned one of the characteristics is community controlled or community led. That's particularly important for First Nations communities, where obviously what works in the city is not going to work out in the bush, and so the challenges become different. But if you actually look at the snake model, which has been quite which is very influential on our thinking, they sort of characterise the way in which the early learning system looks like as a series of really concentric circles, where the child is at the centre, and then there are all these other relationships around the child building out to the extended family, the neighbourhood, the community, the society. And that model of support, lots of different relationships, we think is a really powerful way of thinking about the early years. It's another way of saying it takes a village to raise a child, but I think there is the way in which the Aboriginal communities conceptualise a good early learning model is, we think, very powerful, and one that could be applied more generally.
Are you partnering with SNAKE or with any of the other community-controlled organisations?
Yeah, we're in regular dialogue with all of them. So they're either represented on bodies that give us advice or involve themselves in our meetings from time to time. We're in regular dialogue with SNAKE and with Ms. Little and the other leaders. There's a range of community organisations across the country, some real leadership out of Queensland in this area, which is very powerful, and also in Western Australia, we've made connections with a range of Aboriginal community groups there who have participated in informing our campaign.
Okay. I believe you do have a 10-year joint venture with the WA government to deliver early years initiative.
Yeah.
Are you able to give us a bit of a short summary on what you've achieved to date in Western Australia?
So you might be familiar with an initiative which is one of Foundation's early demonstration projects in an organisation called Chalice School up at Armidale. That was a sort of a really innovative teacher who decided in a community where there was high degrees of disadvantage to actually, even though she was responsible for a primary school, she decided she wanted to look for the babies, because she knew that they were on their way into the school, and she thought if she could reach the mothers and the babies before they arrived at school, she'd be able to deal with the sort of quite poor results that she was getting. And she did that and created essentially a species of a children's centre, which we financially support. And it's been evaluated and it's been a very successful model. What we wanted to do was to then extend that. And so we've extended that to 4 communities: Derby, Bidjadanga, Armidale itself and Katanning. And those 4 communities, in partnership with the West Australian Government, and now actually recently with the Commonwealth Government, bringing Connected Beginnings to connect up with that work, is working on a place-based initiative where we have the community sets up a working party. We fund a community navigator who works with the community to then ensure that they have the support they need to support the early years initiatives that they want to promote within their community. So they're given evidence about what's happening in their community. They're also giving ideas about what other communities are doing, and then they choose from that menu, and we support them to do that. So it's early days. We've only just set up the governance arrangements and the navigators in each of those communities, and they're in the process of developing their community plans.
Are there any particular KPIs for this, or are we measuring success? Sorry, I've only got 1 more minute.
I suppose the AEDC would be our ultimate measure, the Australian Early Development Census, to see how children are going on that scale.
Okay. Just my final question is, what we've heard this morning from lots of witnesses is the co-occurrence of poverty or financial stress and mental health issues, particularly related to families experiencing COVID and in this pandemic. Given that, Senator Lambie and I may have some very different views on this, but the CDC the research is showing that income management in the Northern Territory has had some very declining child wellbeing outcomes. Putting compulsory income management into communities during a pandemic is likely to have adverse impact. Do you have any thoughts or comments on that?
Sorry, Chair. I was just wondering, are you talking about the CDC card or are you talking about the basics card? Because there's 2 varieties on them. Which one are you talking about?
Sorry, Senator Lambie. I'm
talking about the basics card or the CDC card, because they're 2 very different cards.
Okay.
And they're mostly split. So I'm just wondering which card you're talking about, the basics card or the cashless debit card?
Okay. Cashless debit card.
Okay.
Which is actually what I said.
Okay, thank you for that clarification. Mr. Weatherall.
Yeah, so look, I probably prefer to confine my remarks to the children's plan that we're promoting. But what I would say is this, that anything that puts additional pressure on families at a time like this is likely to have its consequence for the most vulnerable children in those families in those first 5 years. So all public policy measures should be looked through the prism of what effect they're going to have on children in families where those pressures are likely to have a negative effect on their wellbeing. So that would be, I think, that should be the touchstone for any policy, whether it's income management, whether it's childcare policy, any of the steps that we're taking that makes the lives of children more difficult during this period is something that we should reflect on. And I think the reason we don't have that perspective is there's no agency in government that's dedicated to looking at the first 5 years. There's just nobody there that's actually looking out for children in the first 5 years. So any policy that has a differential impact on a family because they've got children in them needs to be reflected on.
Yeah,
Okay.
and we've heard that evidence this morning. So thank you.
Thank you, Senator Cox. Can I go to Senator Sheldon?
Good. Thanks very much, and thank you, Mr. Weatherall, for joining us today. I just want to go the question you raised about the situation for ABC Learning, for example, and the pressures that are on the industry. Certainly argued pre-COVID, but certainly as a result of COVID. And looking at this question of the COVID recovery period, do you see that there's, and you've touched on this in a number of your answers, but just if you want to add anything to it, do you see that there needs to be further support for early childhood education sector to bring us through this recovery?
Yes, I think so. I mean, there's been, as I said before, the Commonwealth, after we published this draft, this plan, the Commonwealth did act to waive that fee, but that's sort of only half the problem. It sort of still leaves the burden on the childcare provider. Essentially, what happens is they lose half of their revenue during that period, and that actually is likely to become unsustainable for a number of the providers. So I think the financial stability support needs to go further than just the waiving of the fee, which doesn't really, I mean, it's just really, from the Commonwealth's perspective, just a regulatory proposition. It doesn't actually involve them providing any financial support. So I think something like free access to early learning and childcare for families currently in a hotspot or lockdown, but when we say free, also meeting the contribution that would otherwise be made by the parent. I think the other thing that is a continuing problem, was a problem before the pandemic and it's now been exacerbated by the pandemic, is the whole question of workforce shortages. What we're seeing is there's a range of services which are simply unable to attract or retain people to work within them. That creates real issues of quality, because people don't have the experience or the longevity. I mean, this is an incredibly important and highly sophisticated area of expertise, and to lose people with a turnover rate of something like 30%, leaving aside what that does for the sort of relationships that are formed between children and the care and the early educators, that is a major issue that needs to be addressed. I think the Commonwealth's holding a workforce development strategy which needs to be acted upon and properly resourced. So there are at least two areas I think the Commonwealth could engage immediately to assist the sector to deal with this difficult period.
Ms Weatherall, in addition to those comments, thank you very much for those, and in addition to the looking at the employees in this high turnover, is one of the issues that you've observed issues regards pay and retention?
Yeah, I mean, there are really three issues. Pay is actually, ironically, the third most important issue, but it's sort of like the insult to injury, the straw that breaks the camel's back. But when you're not respected professionally and you don't get given the space to be able to practice what you've learned and put it in place, because there are just insufficient resources to allow you to deploy your knowledge, and then if you have insecure employment because you're just the nature of the engagement, and you don't have holidays and the other professional leave that tends to associate itself with school-based education. Then on top of that, the pay, which is quite low, is sort of the straw that breaks the camel's back, and people just decide that they can't commit to this sector, or if they do, they're looking to. If you look at the early years sector, there's the school-based early educators, then there's the preschool early educators, and then there's the childcare, and there's almost a hierarchy, and the wages are different and lower as you go down that hierarchy. And of course, many people obviously are looking to then move into the school-based system so they can enjoy the wages and conditions that might be attracted there. But that keeps impoverishing the early years system, which is bad, obviously, for children.
On the issues of retention and pay, and you highlighted three particular examples of what you see as workforce challenges. Is there anything you can suggest about what the federal government should do about addressing these issues?
Well, I don't think you're ever going to get it. There's been lots of, sort of false starts on this sort of trying to address pay and conditions. The union's been running campaigns, the Big Steps campaign over years. Various governments have talked about doing things in this space, have never quite got around to doing it. So there's a degree of frustration, I think, in the workforce about this. But I think the best view at the moment is there's never really going to be a significant change until there is a proper, coherent system of early childhood. If you look at the journey that the early educators are on, are probably the similar journey to the nurses and the teachers. Back in the day, it was sort of women's work. It wasn't properly recognised. It wasn't properly paid. But then it became professionalised, became systematised, and then what followed from that were higher wages and then higher professional standards. And I think that most of the sector think that the big answer is having a proper system. So if you have a coherent, established system like the education system, not this precarious system that falls over at the drop of a hat, you're more likely to get the sort of changes that are going to ensure that you the right changes for the workforce.
Good. Thanks very much for that. Back to you, Chair.
Okay, I'll just check in with Senator Patterson. Do you have any questions? No further questions. Mr Weatherall, what, again, the committee's terms of reference is looking at the federal government's response to COVID-19 pandemic. And
yes.
So are there particular things you would like the committee to know that perhaps we haven't covered this morning about the particular effects of COVID on this age group that warrant a response? I mean, in a sense, they're a bit of a silent age group, even though they're a very noisy age group. They're a bit silent in terms of some of their issues being well understood by policymakers. So are there things that perhaps we haven't touched on yet that we should be focusing on for this group?
We touched on some elements of the data.
Yeah.
I would interrogate the data, any of the data that Commonwealth's holding about this age group.
Yep.
And I think that there's probably more hanging around than that's been publicly sort of observed. That data needs to be surfaced to actually find out what is going on. And you've got a real life experiment here. You've got a control group, some states that aren't affected, and some states that are affected. So you're pretty quickly going to see what the particular effect of COVID is, and that's going to then lead you to be able to draw certain conclusions about what steps should be taken. So I think that's really important first step. Obviously, Doherty needs to be funded to do the modelling so that we know what is going to happen. And I think but on the National Cabinet agenda, doing this as a standing item.
And you touched on before some way of, and this goes to data as well, I guess, for some of the kids that have missed out because of COVID and lockdowns. And, many parents I've spoken to have voluntarily withdrawn their children from early education centres, out of concern about their children's health. So we know that there is a population there that perhaps even in non-lockdown states are missing out. So this idea of sort of a COVID catch-up or a guarantee of access, how do you see that working, again, in the kind of fragmented world we live in of private daycare, community-based care, states' different kind of approach to preschool and eligibility? What would that look like if the federal government was able to say, look, for those kids that missed out, we want some catch-up and some investment into this group? Do you have any ideas on that?
They've already got this idea of a 600-hour entitlement to preschool. So those children that didn't get that in 2021, I think trying to make urgent arrangements to make up those gap hours But I think that's going to be tough for the remainder of 2021 because we're sort of barreling towards the end of the year. So I think we're probably looking at some additional support for the first years of primary school. So entering into dialogue with the states about what, I suppose it's preparatory school, I don't know what it's called in different states, reception, some additional support for those children that missed out on the preschool, and just enter into an urgent partnership to actually jointly address this question in the states and territories that are affected.
Yep. Okay. I think that's all my questions. Is there anything that you'd like to say to the committee before we let you go that we haven't covered off?
No, thank you very much for your time. I really appreciate it.
I'll do a last check around the board. I don't think anyone's got their hands up. So, Mr. Weatherall, can I thank you very much for your time today and for advocating on behalf of this 0 to 5 Australians. We really appreciate it. It has been, children, young people's, and the impact from COVID-19 has been something the committee's been focused on. So we greatly appreciate your evidence today. It will assist us with our ongoing inquiry. Thank you. And colleagues, can I thank you very much for appearing today as senators? And I'll see you soon next week. But the committee will adjourn. I was looking for the right word. I was going to suspend. Thanks, everyone.